Welcome to your Power Hour. This month of July, we're talking about hygiene, patient reactivation. My name is Debbie Seidel-Bickey. You probably know who I am. I'm the founder and CEO of Dental Practice Solutions. I started my business just over 24 years ago, still here, and I'm excited to bring to you one of my favorite people to work with, Ryan Johnson, who's the Director of Partnerships for Dental Intel. And Dental Intel has some powerful tools to help dentists who are challenged with the holes in their schedule. So during this month of July, we're talking about reactivation. This is the best time of year to start really focusing on getting your patients back on the schedule. Thank you for joining us. Ryan, I know you're super busy. We just need you for another maybe 15 more minutes. I know he's got to run, but I'm going to have him show and share with you these powerful tools and how you can very easily reactivate your patients. So Ryan's going to walk us through what you can do, this actual process to easily reactivate the highest, most valuable patients. Per patient production is what we're looking for first to reactivate. He's going to walk us through, and then I'm going to share with you how you best put the process into place after you've grouped these patients. How do you automate that? How often do you send out the text messages? I'm going to talk about that. So we're going to talk about assessing your patients in the beginning. I want to show you how much money you're probably looking at right now. And this is a low amount. I always like to keep it low. I'm looking at some metrics right now. I'll be meeting with the doctors next week, and I'm seeing 2 and 3 times the amount of dollars that I'm going to show you today. So hopefully, if you do look at your numbers, doctors, ask your office administrator, ask your lead to help you see what is your potential, okay? Look at the number and then work this strategy you'll learn today. So we're going to talk about getting them back on their schedule, the process, how to keep them back on the schedule. And I'm going to share with you the Smile Club, which will keep them back on your schedule. You have next steps that's in your handout. We're going to have Q&A, and then I'm going to tell you there's another Power Hour in August. Every month we have one topic, 2 different dates. So Friday, August 2nd, 9 a.m. And I think the next one's on the 12th. It's in your handout, and that one's in the evening. So be sure that you check your email because I will be sending you the link to register. So I want to share with you, this is an office that they used to be working with me after 18 months. They're on their own. They're doing pretty good. They actually grown. They have an associate and their second hygienist since 2021. They've got 2 additional hygienists and the associate. So they've got 288 unscheduled patients, and you can see if they bring them back just for the hygiene is that much, $43,000 basically. And their opportunity, is $245,000. Did I explain that okay? Ryan, do you want to add anything there?
No, that was great. Yeah, just like
Okay, great.
Debbie was. Yeah, thank you.
So I wanted to tell you that I want you to look at this number because, if you look at these dental economic journal articles, and they're saying that patients average, I think, around $800 a year. I'm going to say 600. Okay. We teach our doctors how to average $800 an hour on their schedule. And the hygienists, this office I'm sharing you with you right now, the hygienists are at approximately $275 an hour. But the average, we're just going to say the average annual patient production is 600. I kind of went low with it. That's almost $173,000. Doctor, if you never look, you'll never know this number. And the majority of offices that I have their dental intel for, they're lined up to do a consultation with me in the next week. I can tell you it's more than $173,000. It's a lot of money. This office is doing good, and that's because for 18 months, they had my coaching. I was their accountability partner, and they're just humming along on their own now. So I want to show you that it's very important for you. Doctors, you're paying your team members, your employees are being paid higher than ever. So you've got to get this automated. I'm not going to tell you to be calling I was a dental assistant back 40 years ago, and we would call on the phone. I hated doing that. I had to call on the phone when I had a no-show. And there was a person doctor hired just to call patients. Take that out of the equation here. So I'm going to share that with you. There's one person. I have it's called there's a book by Michael Gerber, Traction, and he talks about having leads, team leads, and you need to have one person who doctor, you can go to, and they're held accountable for automating the process. They're overseeing it, and your job, doctor, is to check in with them. Everybody needs to be cross-trained so they can do what Ryan's going to show us in a few minutes. And even if I'm your hygienist and I do have a no-show, it's a button I'm pushing, and I have a pre-made template to send this patient, whether it's text or email. And then always look at your numbers. Daily, I teach the team how to look at the opportunities, and we have a scorecard for the team members, and they're driving those opportunities forward into productivity and without working harder. So when you work this, I want you to know that the first thing you're going to do when you're reactivating, so it's going to be a text message. I wrote some notes down here. I want you to know that there are, I think 90% of people, I can't find my notes here. I have so many notes, but 90% of people will see their text message. Do you know the statistics on this, Ryan? 90% of the people see a text message quickly, and do more like 98% of them, well, we hope they respond. There's this new generation that doesn't respond to text messages. I'm learning because they're my nieces and nephews and they're not responding. Maybe it's just my text message, Ryan, but what do you know about this?
Yeah, no, I mean, it's going to be, I think it's 90% higher will respond to a text message as opposed to a phone call.
I see. Thank you for clarifying that. So the next thing, and I'll walk you guys through this a little bit later, like what to do if they don't respond to the text message, what to do next if they don't respond to your email. The last thing is a phone call. And there are some patients today that still want a phone call. So we're going to show you how to put this into supercharge mode. We're going to turbocharge this process for you. So I want you should have printed out your handout. I sent you quite a few emails, and I asked you to print your handout and have a pen ready to take copious notes. Now, Ryan is very valuable to me. He's very valuable to my clients. And right now, I want you guys to stop any distractions and focus, because Ryan's going to share with you, especially doctors I saw doctors are already registered for this. So I hope the doctors are here because I want them to see how much time they're saving for their employees. And time is money. So it's a super simple way. And Ryan, let's begin the activation process. We're going to turn it over to Ryan's screen so he can share with you the Dental Intel dashboard, and it's at your fingertips when you're using Dental Intel, and I'll share with you how to get this moving in the right direction with Dental Intel at the end of this webinar. Over to you,
Perfect.
Ryan.
All right. Thank you so much, Debbie, and appreciate everyone being here and looking forward to sharing this with you. So like Debbie was saying, we want to really help save time within the practice. And there's a lot of ways that we can do that. So first and foremost, like that last slide that she was showing, the screenshot she had, we can take a look at our unscheduled patients really simply to see, okay, which bucket are all of my patients in that have been in the last 0 to 6 months without a future appointment, last 6 to 9 months without a future appointment, and so on. And one of the things that I love working with Debbie about is that big focus on per patient production. That's something we align with really well here with Debbie, is because we understand you're busy, you all have goals that you need. And so how do we find the way to find those patients that can have that per patient production with the most per patient production? So first and foremost, one of the number one things we want to help out with is your team is busy. You have so many things going on in your practice. We don't want the team to have to hunt for information anymore because if we have to hunt for it, we just aren't going to have the time to do that. So what we can do is here's the first step is this is kind of the cleanup mode. The patients that have maybe slipped through the cracks within our practice, we can come in and say, okay, who are all of my patients in that 0 to 6 month category that do not have a future appointment? And now, instead of working just top to bottom on this, we can say, how do we find that per patient production? And so now we can see those patients that have come in that do not have their next appointment scheduled when they were past due for hygiene, those types of things, but then also the highest dollar of unscheduled treatment. So if we only have time to send 5 text messages, call 5 patients, we want to find those right patients. So that's a process right here. The other thing that I love that's going to automate things even more and help create a really good process within the practice to where if I'm coming into your practice and I say, hey, I need to check my work schedule, I'll get back in touch with you on scheduling my next appointment. We have those patients all the time. So now let's automate that to really help out team members. So if that is said to me, I can say, Ryan, not a problem. We will give you a call like Debbie recommends. Best practice is in 2 days. And so what we would do is come to the settings. And again, this is going to be automated. This is the best part. This eliminates hunting and ensures that patients do not slip through the cracks anymore. And so what we can do is we can say follow-up tasks. And so now what we would do is for hygiene recare, we would come in here and we would say, all right, I want to set up some hygiene recare follow-ups. And so what we would do is we could come in here and say, let's say a patient comes in, leaves without scheduling their next hygiene appointment. We would say, I want to reach out to that patient in 2 days after their previous hygiene appointment. And the best part about this is now what we can do is we can assign this to a specific role within the office or team member. So if you have someone already responsible for going and printing the reports, finding all this information in the practice management software, cross-referencing the reports, gone are the days with that. Now we can just say, hey, when those patients leave, we want to assign it to a role or a team member. And then each and every day, when that team member has 10 minutes, all they have to do is come to their open follow-up tasks and it'll tell them who they need to be reaching out to. Now, this is going to ensure that these patients are not slipping through the cracks. But again, with holes that come up on the schedule, let's say for this week or next week, we need to quickly identify which patients we are going to be reaching out to. And again, just like Debbie said, what our goal is finding those patients with the most per patient production. And why is that important? It's because that way, with like Debbie was saying, all the team members that were paying higher than ever, we really capitalize on that. And where we're going to be able to come and do this is this patient finder tool. This is my favorite tool within dental intelligence. Offices I work with all the time tell me that this is what saves them. It has become the right hand man. So for example, what we can do is for that hole that we have maybe in 2 days or next week, we can say, who are all of my patients that are past due for hygiene? This practice, 37 patients past due for hygiene. Yes, we can call top to bottom on these, but like Debbie said, patients most likely aren't going to be picking up those phone calls. And we're not really reaching out to patients that have the per patient production with that highest amount. It's just anyone and everyone that says yes first. And so it's kind of luck of the draw. So let's filter down on this. Now we can come in here and say, how do we do those things simply? And all we would do is say, let's take a look at my unscheduled treatment. And then we can say, I want to see all my patients that are one, past due for hygiene, but also have been diagnosed, let's say, with a crown, or you can do any type of treatment code that you're wanting within the last year. And then we'll say anyone with above, let's say, $750 of outstanding treatment. But then this is where it gets really fun, is we put in that code. And once we put in that code, all we have to do is hit save. We go from 37 patients. Now it drops us down to 8 patients. So now we know we are finding those patients that have the most per patient production opportunities. And what's really cool about this is not something that you have to recreate every day or have to remember how to do. All we would do is come in here and say save, and then we can title it whatever we want. And so we would say hygiene plus crown, whatever it might be. We hit save, and now that becomes a live list for us. So as you schedule individuals off of that list, or as people match the criteria to the list, when you have holes in your schedule, again, that automation piece is really nice to save time. All we do is we come and we find that list and we click on that and we can either call those patients, but like Debbie recommends, let's send a bulk message to those individuals, text them, and see who can come fill that hole. And this is what will really drive the growth of the practice through saving time for team members and identifying the right patients to fill the holes within your schedule.
So thank you very much
And
for that information. Oh, did I interrupt you?
no. I was going to say, I'm just going to turn it back over to you, Debbie.
Oh, okay. Now, one thing I wanted to mention, I don't know if you guys saw that in the screen, but Ryan was showing us 30 days. It was 30 days. In the last 30 days, it was 37 patients. Most, because they have more than 37, but it's over the last 30 days that they have 37 patients. So, and you guys, I want you to look at what you have compared to what you have. So what happened with this office is I haven't been their coach for the last year, and they've added a hygienist and associate. So those new team members, they're doing pretty well because they did not go through 18, they stayed with me for 18 months and they're doing $300,000 a year more consistently since we ended our work together in probably 2023. They started July of 2021 and we probably went until sometime beginning of 2023. So they're doing pretty well because when I look at the other offices who are scheduled to meet with me, I can see their dental intel and it's hundreds of patients in the last 30 days. Like one office today, I saw this week, they've only worked Monday and Tuesday. They had 5 patients leave. So add up $600. Look at that number, doctor. Ask your team to pull that number the last 30 days because that, and then multiply that by 600. That's their annual spend for an average patient in the US. Also, another thing, Ryan, you were sharing a number for crowns, but I also wanted to say, like, they can pick implants. Maybe they'll
Mhm.
have 2 to 4 patients that come up for implants. And that I know a lot of doctors want to do implants. They love implant dentistry. And those are the patients that they take time to think about it. So even, and Ryan, one thing that I wanted you to talk about is like these patients who are 18 months past due. Those people are really good. They could pull those up, right, Ryan? And they can,
Mhm.
if those people need the crown or the implant, you can have different categories saved. And those are the people that you want to get back. You always want to work on the most recent. They're the easiest to get back, but don't forget that 18 months because those people need to come back to see doctor for x-rays, exam, hygiene appointment. And doctor's probably going to have to do some re-diagnosing because maybe they need, maybe there's more decay. Um, and maybe the fees have changed. I don't know, 18 months ago. Now it may cost the patient more. So it gives you that opportunity. Ryan, is there anything else? Like what questions do you usually get about this that somebody might have?
Yeah, no, thank you for that. And with that, like you were saying, those patients that maybe are past 18 months or whatever target or things that you are doing within your practice, whatever that focus is, we can group that and you can have multiple lists that are there at all times for your team members again, so they don't have to hunt for that information so they can quickly act and we can see results quickly.
So Ryan, somebody just sent in a question for you, and they're
Mhm.
asking when they start using dental intelligence with the engagement process, can you tell us, does the engagement, what is the typical ROI in the first month they're onboarding and learning all of it, but what can they expect for a return on the investment?
Yeah, really good question there. So the nice thing with dental intelligence, we work with close to 11,000 practices, and what we see on average within the first 12 months of utilizing analytics plus engagement, and then your services, Debbie, using you as a coach, we
Mm.
see an increase of production of $297,000 in the first 12 months. So very powerful.
that's my client that I was talking about. Every year since 2022, they've been up 300,000 every year consistently, and they're not even, they're on cruise control now, and you can see
Hmm.
it's not too bad. I didn't, I don't, I'm letting them go on their own. They're kind of tired of me. I've worked with them for probably 2 years. We were still checking in, and they're like, we can do this, we can do this. And I'm not too unhappy to see 37, because I see these others that are lined up for their call with me, and it's a lot more than 37. What do you think?
No, I think that's a really, really good number. And like you said, you were with them for 18 months, get them into a really good spot. You're teaching them how to fish, right?
Yeah.
Which is really nice. You're not just handing them food, you're teaching them how to fish to do it on their own. And that's, I think, what is really powerful.
Yeah. Well, Ryan, any last comments here? I know you've got to go. He is being pulled in a lot of different directions, and I so sorry.
No, yeah, well, I appreciate you having me. And it has just been so fun working with you, Debbie, and seeing the results of the practices you work with and just the immediate growth that they're able to see because it's simple things, right? That are it's simple for things to slip through the cracks. And then as you surface those and help coach and train different team members, see really quick results with that by just making little
Yeah.
alterations that really drive large impact.
Yeah. Thank you so much. I hope to have you back again.
Yes.
And then everybody's got your info. Is there anything you want them to put in the subject line if they email you so they know they came from me?
Yeah, just reference Debbie's name on there, and then because you also get special pricing and different things coming in through Debbie that you wouldn't get anywhere else. And so just reference Debbie, and I'll know how to take care of you.
Okay. Thank you so much, Ryan. Guys, sorry for the
Thank
diversion.
you, everyone.
I just want to be respectful of his time. He's very busy. Thank you.
Thank you.
Okay.
Bye bye.
Bye-bye. Okay, guys, we're going to go back to my screen share here. So let's talk about your messages. What do they say? So as Ryan said, 48 hours you want to contact those patients who leave. So that's what I taught the office that you just saw the metrics for. 48 hours later, they're writing the tasks. 48 hours later, they're sending a text message. And that's why they don't have hundreds that are due within the last 30 days. I do have some people, some offices that I'll be talking with the doctor next week about working together. And I'm not disclosing their name or anything. I don't know that they're going to work with me, but I'm telling you that there are over 100 patients. They've got multiple offices with 100 patients walking out the door every month. They're super high productive offices, and it's an open back door. And so I want to help you to save time and add $300,000 to your production. Oh, I also wanted to mention, in case you are thinking about a coach, we don't normally work with you for more than 6 to 12. A lot of offices will work 12 months with us, not normally 18 months, but they found that they were having so many leaps and so much growth that they asked me to stay. That's why I was working with them for 18 months. It's not normal that I work with somebody that long. And it's really great to have me as an advisor to just kind of check your dental intel and your, patients. I'm like your accountability partner. And that's something I can just be looking at on the side when you have dental intel and engagement and you want me to look at it. So I wanted to tell you, wrote down some notes. You're going to, first of all, that those patients, there are 37 that they need to send a short, sweet text message. I also want to say that I am seeing that this summer of 2023, and I saw some new clients of ours, they had 5, one of the offices had 5 in the last 2 days leave without scheduling their next appointment for hygiene. So I recommend that you tell the patient, we're going to contact you to get it scheduled. And in fact, if I'm the hygienist and they say I can't schedule it, I'm going to say, Joni, I know that you always like Friday afternoons, 2 o'clock. So I know you got to go, but I see you every 6 months on a Tuesday or 5 o'clock Friday, whatever. Like, I'm the type of patient I like to come in at 1 or 2 o'clock in the afternoon. So they know, like, I have a physical therapy appointment after doing hygiene for so many decades. My neck is messed up. So I see a physical therapist on Tuesdays at 1:30 or 2 o'clock. If I'm in a hurry, they can always say, Debbie, we'll see you next Tuesday. We got a 2 o'clock. We'll even send you a text message. Okay. And I'm running out to my car. And that's what I do as a hygienist. I say, Joni, I know you like Fridays. I know you like the last appointment on Fridays at 2 o'clock. I'm going to put you in there in 6 months from now. It's going to be June 16th at 2 p.m. I just arbitrarily said that. I don't know if that's a Friday, but and then I don't have to have anybody follow up. But for those people who slip through the cracks, you want to tell them we're going to send you a text message and then have a link where they can click and schedule, or at least have a phone number where they can click and call you back. Have the two-way texting available. Most companies that do patient engagement, they should have two-way texting so that patient can say, give me a Friday at 2 o'clock in June, okay, or December of 2024. So keep the messages, the text messages should be no more than 2 sentences. Now, for those patients who are over, like I would say, if it's 2 weeks, 4 weeks, or 18 months ago, what I like to say in your text message, what I recommend is that you say the patient's name and you say, we miss you. Please give us a call. Dr. Jones wants to see you. And I mean, it just shows you care, saying, we miss you. Dr. Jones asked for you to call. And then you've got the number there. And they will be calling and they'll say, why does Dr. Jones want to call me? And I'm going to share something with you in a few minutes. It's called the R2R. It's reason to return. And it's one of the systems I created probably 7 years ago. And it actually helps you to be able to click on if you have Dentrix, Eaglesoft, or Open Dental, that's perfect. They're the Cadillac, the Lexus, the Rolls Royce of dentistry and practice management software. So you can easily see who's calling when you're using their patient engagement, the proper patient engagement. You see who's calling, they pop up in your computer screen, and then you can click on their electronic record, and in the last line of their clinical notes will have the reason they need to return, and you know what's valuable to them, what could be their objection. It's going to be either time, money, number one, time. They don't want to have pain. Some patients want to keep a healthy mouth, other patients aesthetics. And that's in the R2R. And now that person on the phone can say, the reason why we called is because we haven't seen you for your hygiene appointment. Doctor's concerned last time you were here, there was an opening in that tooth on the upper left. There's bacteria sneaking in there, and we diagnosed a crown, but you didn't schedule it. We've got to get that scheduled because it's super important to put a halt to losing the tooth, that it's going to cost more money. Say things like it could cost more money if we wait any longer. Or for these patients that are 18 months or more overdue, or 12 months overdue, you've always got to check, do they need an exam? What kind of exam? Periodic, comprehensive? Do they need to see the hygienist? So they can see the hygienist. And some of these patients in some situations, after seeing hygiene, getting new x-rays, they can go to doctor's operatory. Doctor can do the exam, and maybe it's an individual case by case. At that appointment, they can also see doctor for at least the exam, re-diagnose, and maybe even start the crown prep. So you got to do this on an individual case by case process, but that's the first thing. If somebody doesn't text you back right away that day, you've got to know, you want to check, because you're going to go to that list that Ryan showed you, and you need to look at that list every day. Every day. Remember I said there's this book, and it's by It's called traction. And I want you to know that traction teaches that every area of your practice, every area of the business has a team lead. Maybe you only have one front desk person, so they're your lead, but they got to check, they've got to look. And that's what we teach you to do is before you even seat patients, the first patient of the day, there's a 10-minute team huddle. And as you know, I work with a lot of big practices where they have 4 doctors, 6 hygienists. They could have 10 team members or more, but we're doing it in 10 minutes because we've got dental intel. And dental intel, I teach the team how to look easily. So your front office is looking. And at any point in time, any day, doctor can say, tell me how many patients do we have right now in the last 30 days? I recommend you guys, if you do nothing else, look. When you look at your numbers, they tell a story. So you're going to send another text message to that patient in 3 days. Within 3 days, you're going to send another text message. And this text message can say, Debbie, we're concerned Dr. Jones asked to have you call the office. And there's your phone number, and they can call. They're hopefully going to call because we've got to create urgency. And I'm going to tell you that you've got to create these messages. Like I said, no more than 2 sentences, but it has to speak to your brand, your office brand voice. Okay. I know my colleagues who are dentists, they love this message. We miss you. That makes them feel like, wow, they really care about me. Because I know when I first started dental hygiene back in the 80s, the dentist, one of the first dentists I worked for, he was all about family. He had pictures of his family around the office, and he wanted his patients to feel like family. So what do 2 sentences say in your text message that make your patients feel like family? Wouldn't that be, we miss you, doctor's concerned, some words and phrases like this, asking them to give you a call. When you say you're overdue for your cleaning, nobody wants to take time out of work to get their teeth cleaned, and more about that later. Now, I recommend that you can. Years ago, I would teach send the text message, make a phone call, but nobody answers the phone. If you believe in phone calls, which I do believe in phone calls, but people don't answer their phone, especially if they don't have your number saved. And so they're not going to answer. Remember to leave a short, sweet message. Hey, Joni, this is Debbie from Dr. Jones' office. We miss you. Doctor asked me to give you a call. Please call us back and give them the number. Thank you so much. Boom, you're done. And so maybe you have one day a week where you actually pick up the phone, but it's not that often anymore. Everything's automated. You can also email your patients. And if you have patient engagement software, make sure that you use one of their templates. Right now, it's a popular thing to email a template, use it or lose it. There are various ways to say that because some of your patients, and I know some of you are insurance driven. I don't recommend that. A lot of offices come to me because they want a strategy to get out of insurance. Now, I'm not an expert on getting you out of network, but I can help you get more cosmetic cases paid for and on your schedule. And that automatically is usually not covered by insurance. So that's my role. And I can tell you that these patients, some of them have insurance that's going to end in December. So now you've got to get them on the schedule. Now, somebody else is asking, you guys are asking questions. So I'll make note to answer these at the end of this webinar, the Power Hour. Always have a call to action. So please call us or call our office. And then you've got to have your phone number there and make it so they can press that number in the text message and call. Now, another thing, I have in the last 5 years seen offices that are still using their own mobile phone to text patients. And I want you to know that's not HIPAA compliant. Now, let's move on. So it's going to be in that order. I recommend that you send 2 text messages. Hopefully, most of your patients will respond as soon as possible because they feel like you care. Send a second text message about 3 days later, and then an email after that. If you're not getting a response, do call. And then if you don't get any response, I do have a letter that you can send that's worked really well. I know you do not want, and I saw this recently that an office they were sending postcards. Guys, postcards get trashed. They get lost in all the junk mail that we get in our mailbox. So we're talking about, okay, so short and sweet, to the point, include your scheduling link. Now, your voice message, remember, it's short and sweet. Basically, we miss you. Dr. Jones asked me to give you a call. Please call us back and give them your number. Thank you so much. Talk to you soon. That's it. And you can get if you've got to call 15 patients, it's going to be really quick. And the thing is, guys, I mean, I probably have voice messages waiting for me to check, and my voice message says to text me because I just have so much on my plate. The last thing I want to do is check my voice mailbox. So no, you're not getting when you call, most people aren't answering. And then the other thing is they're not even checking their voice messages for maybe a few days, maybe never. So what emails are you sending? And then the other thing is, are you sending monthly email campaigns? Now, I know a lot of people they're flooded with so many emails. So I recommend that you also put important information on your Facebook or Instagram page. People are on Facebook and Instagram way more than their email. So if you have like I was teaching the offices we're working with, I was teaching them to actually let their patients know that we're having an Invisalign day or a whitening day this week. It's July. We've got 4th of July. September, we've got Labor Day, and people tend to call and cancel. They think they're too busy to come in because 4th of July is at the end of the week. Then we've got Labor Day, which is on a Monday, and they're out or they don't get the message and don't show. So give them a good reason to come in the week of those holidays. You've got Thanksgiving coming up, then you've got Christmas. So give good reason for patients to specifically schedule on certain days because maybe they want Invisalign and you're giving $500, $300 off. And then I'm going to teach you guys about the teeth whitening and how you can give them a discount on that because it's going to cost you a lot less money and give you a net production of close to $100 on each patient when they leave with their whitening kit. So we're going to talk about keeping your patients on your schedule. I talked about this a couple of minutes ago. It's called Reason to Return, R2R, and that is the last line of your clinical notes. And it's always brought down. Like if I'm the hygienist and I'm saying it'll have the template has R2R there. And I'm going to say money, I'll put a money sign and I have the template already and I can back out time, aesthetics. And it shows money. And then I'll say hole in tooth number 14, crown. So now when the patient calls to cancel, or the patient calls to schedule, like we're talking about today, you're there with these specific engagement systems, like we just shared with you today. When they call, you see their information. Oh, it's Debbie Seidel calling. So I can click on her name. I can pull up her clinical record right away, and I can see, oh, she's a money person. Oh, Debbie, yes, the reason why we sent you that text message. Doctor's concerned when you were here for your hygiene appointment. In fact, it was like 9 months ago now. Doctors noticed on the x-ray that you have an opening around this filling and bacteria sneaking in, and we're getting worried. We're concerned that it could be something more extensive and cost more than the crown. In fact, you haven't seen your hygienist in 9 months. So let's get you on the schedule for your hygiene appointment. We need to update your x-rays, and doctor needs to re-examine that. And then the patient's like, but I don't have time. Well, it's going to take a lot more time if you're going to need an implant or something else more extensive. So let me get you in. It'll be 90 minutes. You'll be with Debbie. I'll have doctor re-examine that because we don't know. There was so much bacteria sneaking in that hole around the filling. It could be a lot worse than just a crown. And I want to help you save money. Notice how I have enthusiasm. I'm very passionate about what I do. And I hope that you feel passionate and enthusiastic about what you do because I just love what I do. And I'm on a mission. We're not talking about this today, but when I speak at dental conferences, I'm usually speaking about the mouth-body connection, and I'm really interested in helping my patients live a longer, healthier life. And this is something that I say consistently. I love to help people like you understand what to say that creates urgency for patients to want what they need. And so it's all a process. These words that we're talking about that are part of the R2R, these words, it's really the hygienist that gets to know the patient because they're there with the hygienist for almost a whole hour. They're sitting in the chair. And then they come back at least twice a year. So the hygienist has a lot of power in the words they say, like hole in the tooth versus tooth decay. Yes, patients tell you, oh, I know what tooth decay is, but which word paints a picture? Tooth decay or hole? Bacteria sneaking in or old filling? Which one paints a picture? An old silver filling or fracture lines, cracks around that old filling? Paint the picture and then let the other team members know. When doctor comes to do the exam, the hygienist is going to say the same words. We talked about the crack in that old filling. We talked about the need last time Debbie was here, you diagnosed a crown and we took x-rays and I need you to make sure that it doesn't need more than a crown today. And then when we walk that patient and we hand them off at the front to the front office, again, we're saying doctor's concerned about the opening in that old filling. Doctor wants to do a crown as soon as possible. We're concerned it could be getting worse and cost more money. This patient that is in the chair, money is their thing. That is the objection. So also remember I said, we want to save you. We hope it doesn't cost more money. We want to get you in sooner than later so it doesn't get worse and cost more money. So it's value and benefit. We always have to know what the patient values. Last month, we talked a lot about, in our webinars, we talked about the new patient exam. And I don't know if a lot of you that I see registered for this didn't come to that one, but I would recommend that you schedule just maybe a workshop and I can walk you guys through that because when you have a new patient, there are certain questions you can ask, and those questions will help you understand what your patient values, and now you attach a benefit. So I want you to stop saying cleaning, stop saying tooth decay. Say words like preventive care. You've got inflammation, there's infection, there's bleeding, and just, there's active disease. Say words that they understand and paint a picture. The other thing, to keep patients on your schedule so you don't have to spend time on reactivation, always make sure that when they update their health history, hope you're doing that every year and it's all electronic, not paper, and they just tap on the screen. And then they swipe and there's a change of appointment procedure. Teaching your patients how to treat you. What do you expect? If you want to know more about cancellations and how to stop them, register for the August webinars, and we're going to take a deeper dive into that. So you've got to have your patients know what is expected. I can tell you that most of our clients that work with us, I'm so happy these doctors are being bold. They're saying, I want 72 hours notice by a phone call in during our business hours. And on your voicemail, you need to tell your patients, teach them, if this is an emergency, please call my number. If you're calling to change your appointment, we do not accept appointment changes by phone. You'll need to call during business hours. If it's an emergency situation, here's doctor's number, and say the number again where they can call doctor. One time, a patient called doctor's cell phone to say, I can't be there Monday morning. You know that Monday morning, you have a lot of patients. Almost every Monday, people are calling saying, you listen to your voicemail, and it's saying, oh my gosh, I realize I can't come today, Monday. So now you're going to have things automated like Ryan showed you. So you can click a button and send a text message. By the way, you should have templates for your text messages and emails, and you can save them on the computer where you're sending those text messages from. You learn all of that. The whole first month of working with Dental Intel and engagement is all about onboarding and learning how to automate things. So in this situation, Monday morning, you've got a patient, maybe 4, that called and said they can't come in. And so now you push that button and they get a text message. It all needs to be set up and automated. And Dental Intel's engagement helps you get that set up. I'm the one that helps you with your Dental Intel. Like Ryan said, I get discounts, huge discounts, and you don't have contracts when you go through me for Dental Intel. Engagement, something different. You have to talk to Ryan, but I do get discounts if you mention my name. Let's talk about patient loyalty. I created the Smile Club in the first economic decline that I can remember. Well, I think there was an economic decline in the 80s, but I know for sure in 08, and it lasted in dentistry to 2015, dentists called me saying, Debbie, help me with this hemorrhage on my schedule. And so I created this system, and it was all around whiter teeth and getting teeth whitening, but the patients had to come in and get impressions and come back after the team and the employees fabricated a tray. So when we talked last month about when we talked about the new patient process, one of the things I'm hoping you're doing is giving your patients a digital tour, a scan, and always do a smile evaluation. So it's super simple. I always, I do temp periodically, and I keep a little shade guide in my drawer. And then I say, let's take a look. And it takes just a moment to do that. And I ask them to look in the mirror and tell me, where do you think you are? And a lot of patients will say, oh, I'm around here. And well, where do you want to be? And it's here. And then I tell them, let me show you how that's done. And I actually keep this gel, and even when I'm temping, the offices know me where I temp as a hygienist. And I can tap this with, I don't think I have it on my desk right now, but a micro brush. And then I put this on my tray and I tap it on their teeth. And then I polish their teeth, and I come around and polish that last. And their teeth are always brighter. And a lot of the stains actually dissolve. This is carbamide peroxide, and it also has potassium nitrate. So there is never sensitivity. And the ingredients are as non-toxic as you can possibly get. You can actually go to my website, dentalpracticesolutions.com. I think it's under services or courses. It's one of our services. And we offer the Smile Club. And you get your whitening wholesale. It's actually my ingredients. I'm one of the only that will have these specific ingredients. You can check out the ingredients, and I'm happy to talk to you more about it. But your hygienist, when I'm working as a temp and I do what I just told you, annually, each patient gets a smile evaluation. We also have a written smile evaluation. That's part of when they're updating their medical history. They next go to the change of appointment procedure. They acknowledge that there's a fee charge if they don't give us 72 hours notice. This is what my doctors are requiring. And they have to call the office to change their appointment. Guys, you know that next week, you know your schedule. Yes, emergencies happen. Yes, life gets in the way. But teach your patients how to have respect for you. They can't just think they've got something better to do. So like I was saying, I will have 4 patients out of 8 or 9. I work with an assistant in one of the offices. We have 2 operatories, and there's an assistant. So we both do this. And I can tell you 4 patients leave with their whitening kit. They leave with their whitening kit. And I actually created it so there's a red LED light, because all these patients with perio, they want to whiten their teeth. It's kind of a joke, yes. But you know what? They got the red LED light, and it does help to soothe, calm, and halt inflammation. So they can whiten their teeth. And when they're doing scaling and root planing, they tell me this feels so much better. So that's why I came up with the red light and the ingredients. I am really uh, into research and investigating what I can do so this is not so toxic. So compare my ingredients to what you're currently using. I'm pretty sure you'll see less toxicity. So imagine it's a net of $100 when somebody leaves with their whitening kit. Here's their whitening kit. They leave with this. The hygiene, it doesn't take a lot of time. It's very simple to teach them. It comes with instructions. I have YouTube videos that they scan this QR code, and then they can go and watch videos of how to do this. Patients are super excited about their white teeth. In fact, some of these patients will say, oh, the reason why I didn't want to do the crowns is because I didn't think that I could get whiter teeth. And since I'm getting my teeth whitened, and it's so easy, I think I will schedule for the crowns. I've heard this numerous times. So I want you guys to know that this is a huge benefit to your practice, because part of the Smile Club is that they need to pre-schedule their next hygiene appointment, and they need to also keep their appointments, all their appointments, or else call the office during business hours, 72 hours in advance. I hear my feedback is that patients are less likely to cancel last minute. So I had this slide up here. Okay. Teeth whitening. I want you guys to know teeth whitening is on tap to be an $11 billion industry by 2030. And that's in 10 years. It's grown that much. It's not just whitening teeth. It's toothpaste. It's mouthwash. It's the strips. But most of your patients are going to the internet, to Amazon and Walmart to buy their teeth whitening. Why don't you create a way so that you can get patients to get their whitening from you, and your hygienist has patients walking out the door, your front office, you guys work as a team. They walk up to the front, and we have the promos and the marketing materials at the front desk. They're like, what is this? Tell me about it. Because they see the stand that's saying, ask us about free whitening. When they keep their appointment and they come back to the hygiene appointment as scheduled, they get 1 free pen. And I'm telling you, this pen costs about as much as your net cost is about as much as a toothbrush. Which do you think your patient wants? A new toothbrush or this? When they go to online to get this same thing, something this non-toxic with the carbamide peroxide and potassium nitrate is $20 or $30. They're going to not just take the free one, but they're going to ask to buy more. So you can actually, you'll make like $10 per pen, because you're not paying for a pen like you are today. I mean, it's my business. I have all the certifications, FDA approval. So when you buy from me, I turn over my savings to you. So it increases your per patient production. It's about $100 net that you're getting every time this walks out the door. You're going to get more cosmetic cases, less last minute holes in your schedule. People are going to talk about this. They're going to say, hey, I get free whitening when I come to my hygiene appointment. I got my whitening kit for, I love it. It doesn't hurt my teeth. Well, it's from my dentist. I've been selling teeth whitening to dental offices since 2010. You have much more loyalty from your patients. And also we teach you how to use this carrot to get more new patients. We show you exactly what to do. So when people are searching on the internet for teeth whitening, they land on your dental website. So yeah, it's everything I'm talking about takes a team approach. It's never the doctor feeling they're overwhelmed. And what I do is work with the teams to have a scorecard. Everybody knows what they're in charge of to drive their opportunities. So on the website, you guys can try this out when you, I'll give the link specifically in your handout so you can go there, but it's $79 for a kit if you want to try it out. A fun fact is that I usually am a sponsor for Miss USA and specifically Miss and Mrs. Arizona pageants. So that's been really fun and they do use it. So what do you do next? I have given you a lot of information. Ryan's given you a lot of information. You've got a lot of choices here. And I want to request that right now, if you've been taking copious notes, I want you to write down one thing that you'll do after this power hour, after I give you all this information. What is one thing? Maybe you think, a lot of people say, oh, I knew that all. And yeah, I mean, there's so much that we know, but what can you tweak? If you already knew this, what can you tweak? There's got to be something. Remember, I talked about time equals money. Well, how can you save time? What can you implement? Can you switch out the script on your text message? And what do you text first or do you do a phone call first? Something, choose something here. So I definitely want you to, it costs you nothing to find out more about engagement. And I think you'll probably save money. You're going to make more money using the engagement with Dental Intel. And then I can just do something small with you to look it over each month. I can be your investigator and I do a training with you guys on the Dental Intel. I want you to remember, I did not know. Somebody asked a question I wanted Ryan to answer before he left, and he told me 297,000 in a year because they're using Dental Intel and engagement and a coach like me. What I was telling you, and I always err on the lower side, my client that I was telling you, we saw their metrics, they have consistently for over 2 years had $300,000 net more production. The doctor's had an amazing life and she's got an associate because she doesn't want to work so hard. And everybody knows what they're supposed to be doing. And that's why you saw only 37 patients walk out the door in the last 30 days. And yeah, like some of these offices, when I look at their dental intel and I've got meetings with them next week, I'm telling you, it's thousands. It's over 1,500 patients that need a next appointment. And look at that number. How many patients in the last 30 days and multiply it by 600, because that's the average that a patient spends. And then go and look at last 18 months. How many total? And multiply that by 600. And imagine if you have an accountability partner to get this done. Who can be your accountability partner? Can you depend on your office to do this? Or do you want to have an expert look over this and guide you? Because I have put together what's called the Passion Project. We're taking 2 offices, only 2, and it will be for up to 60 days, no cost. Yes, no cost to work with me because I told you I love what I do and I want to help more. It's super exciting for me to see you grow. And I know you will grow at least 100,000. I did not know. Ryan says if you're using engagement and dental intel, you're going to grow closer to that 300,000. He said that. And that's because you're looking at the numbers and every team member knows their role. They have a scorecard and you have an accountability partner with me. That's where you really soar. So you do not pay for 45 to 60 days until you have, because we're going to know what is your average monthly income. And once you get to 10,000 more, then you have agreed that you're going to hire me as your coach for the next 3 months. Most offices who grow by hundreds of thousands work with me for 12 months, but you're paying me less, way less than 10,000. So if you're paying your coach, let's just say it's not 30,000. Usually it's not 30,000 to work with me. But what I chose 30,000 because that's 10% of 300,000 that you're making net over the next 12 months. Where can you put 30,000 right now today and gain, let's see, 260,000 net, 260,000 net, 270,000 net. Where can you get 270,000 net from 300? You get to walk away with 300. You get to walk away with 270 because you paid your coach 30,000. And I'm telling you, it's not 30,000 to do this. But where can you go and do that? You won't need to increase your overhead to get to the 300,000. There's a lot of opportunities sitting there, just like we looked at the beginning of this webinar. You're not going to be running on the treadmill. And doctor, you're going to stop working so hard because you're not sleeping well. Now you know you have accountability from your team members. And some of you have already said, but I can't get my team to do what they need to do. And we need to talk because I have something I want to tell you about that. That's a conversation we need to have. And there's a way around this. And I hope you've enjoyed this. I want you to know Lori's on our team and she is ready to take your application. If you email Lori, smiledds1@gmail.com, in the subject line, Passion Project, Lori will give you the application. We need you to have Open Dental, Dentrix, EagleSoft. You are going to need to use Dental Intel for 2 months. You get it from me. So you have a little bit of a discount and there's no contract and there's not $1,000 setup fee. So for 2 months, I'm going to tell you right now, it's going to be $900 for 2 months. I'm going to share with your team how to drive the opportunities into production. If you can't do $900 setup for 2 months, then it's not a good fit. And for the opportunity call, I'm going to take an hour with you to look at your opportunities and give you a game plan. It's $100 for the opportunity call. It's a reservation fee that's refundable if you decide or you aren't chosen for the Passion Project. When you apply and you're not accepted, we also have other trainings that we recommend, which are our highest online training is $14.99. There are other trainings that are $45, or you can grab another webinar on biologic dentistry for $25. There's a lot of different options, but you came here for a reason. So I hope that you'll take at least one step. I hope you wrote down one thing that you'll do differently when you go back to the office. And also drop us a line and let us know what other webinars, what other topics would you like? Let me know if I can do a workshop for you guys. We can set up like a 90-minute workshop for your office, and it's another low-cost option for you to get moving in the right direction. Oh, one other thing, some other qualifications besides EagleSoft, Open Dental, Dentrix. You also need to have 900,000 annual production or a history of it since the pandemic in 2020. And we need you to have one full-time or part-time hygienist and at least 1,000 active patients. You need to be open to coaching. And once you see the results, then and only then do you pay. And you will know how much you're going to pay, which is way less than 30,000. It's way less than 10,000 a month. Okay. So you win. And I just want to see more winners. I want to see more of you doing 300,000 more. Even I just said 100,000. Let's just go for the first $100,000, maybe this year. We've got 5 months left. So mark your calendar for the next webinar. It's August 2nd, 9 a.m., August 13th, 5 p.m. The topic, 5 steps to reduce cancellations. We have a few questions. One of them says, let's see. One of them says, okay, so one of them says, how do we save the list that we have a list, where does it save? So when you are in dental intel, so with engagement, you'll also need to get dental intel, and then you save it. It's kind of similar to when you're saving a document on your computer. And I want you to know that they always train you, and they have customer support that you can get in touch with right away. If you're getting things through me, you can contact me, and I have premier support line. So when you go through me, you get to the highest level, and I actually troubleshoot for you when you're doing all this with me. Let's see. So if you have more questions, I know I've taken up a lot of your time, but please email us. You've got the email. It's admin@dentalpracticesolutions.com. Check out the website for the next webinars. If you're interested in the passion project, you have to have Open Dental, EagleSoft, Dentrix, and then you've also got, you're going to use Dental Intel for at least 2 months. And there's no way, if you don't follow my lead, there's no way you're not going to have at least 10,000 more dollars than you already have today in your bank account. It just works like that. So email us your questions as they come in. Contact Lori, smiledds1@gmail.com. She's happy to get you, here it is, and put in Passion Project. She's happy to answer any questions, help you. Thank you so much. I appreciate you. Because of you, I get to do what I love. And I hope to see you on a opportunity call or in the next webinar at the very least. Bye for now.